Welcome to this explainer. Today, we're diving into a really high-stakes biological narrative about how commonly abused drugs literally hijacked our microscopic neurochemistry. We're talking about massive, life-threatening clinical emergencies. We're going to explore the precise underlying mechanics of substances like cocaine, methamphetamine, MDMA, and hallucinogens. So this isn't just a list of what these drugs do, it's about exactly how they do it, how they infiltrate the brain's reward circuitry and kick off a chain reaction that pushes the human body to its absolute limits, and honestly, sometimes way past them. Okay, let's look at the agenda. We'll start with the stimulant crisis, then we'll look at hijacking the brain, system overload, amphetamines and MDMA, hallucinogens, and wrap up with ER management. All right, part 1, the stimulant crisis. So, understanding the pharmacology of these drugs, it's more urgent than ever before. We are right in the middle of a public health emergency, and we really need a clear understanding of what's happening inside the human body. Look at this. The CDC reports that the rate of psychostimulant overdose deaths totally skyrocketed, going from 0.7 per 100,000 in 2011 all the way up to 10.4 in 2022. To put that into perspective, in 2023 alone, over 36,000 people died from these overdoses. That staggering surge right there, that firmly establishes the sheer gravity of what we're talking about. We aren't just discussing abstract chemistry here. We're talking about tens of thousands of lives lost to a profound disruption of the brain's natural systems. So to really understand how this happens, we need to zoom all the way into the brain. Which brings us to part 2, hijacking the brain. To understand how these substances totally scramble human brain chemistry, we're going to use cocaine as our baseline model. Let's walk through exactly how it pulls off this chemical heist, step by step. Think of your brain's synapses, the gaps between neurons, as really exclusive nightclubs. The neurotransmitters, like dopamine and norepinephrine, well, they're the partygoers. Normally, dopamine transporters act like bouncers, right? They clear out the synapse by escorting the chemicals back inside the cell once the signal is over. But here is the crazy part. When cocaine enters the brain, it binds directly to those dopamine transporters. It essentially knocks out the bouncers and bolts the doors shut. This completely blocks neurotransmitter reuptake. Because the chemicals can't leave, they just keep building up. It traps all that dopamine and norepinephrine in the synapse and causes an unnatural massive flood of continuous stimulation. The brain's normal, tightly regulated reward signals, they're suddenly cranked up to a deafening volume. All right, moving on to part 3, system overload. Now we're zooming out from that microscopic flooded synapse to the macroscopic body. Because that localized chemical traffic jam in the brain, it sets off a direct, totally catastrophic biological chain reaction throughout the entire human system. The result of that blocked transporter is what we call sympathetomimetic overactivity. This is a highly dangerous state where the body's sympathetic nervous system, your basic fight or flight response, is excessively stimulated. Because of all that trapped norepinephrine and dopamine, the brain is essentially flooring the body's gas pedal while completely cutting the brakes. It's redlining the engine until it blows. Your heart rate spikes, your blood pressure surges, and your body temperature climbs, creating the absolute perfect storm for severe cardiovascular and neurological crises. And because of that systemic overactivity, just look at the sheer stress placed on the organs. On the cardiovascular side, the extreme vascular shearing forces and the massive demand for oxygen can lead to myocardial infarction, literally a heart attack. The pressure can actually tear the body's largest artery, causing an aortic dissection or trigger fatal arrhythmias. Then on the neurological side, that same intense pressure and stimulation can cause seizures, intracranial hemorrhage, strokes, and hyperthermia. The human body simply did not evolve to handle this extreme level of sustained metabolic and cardiovascular stress. It's just too much. To ground all this pharmacology in some terrifying physical evidence, check out this catheter angiography demonstrating vasospasm of the right middle cerebral artery. Notice how severely narrowed that crucial blood vessel is. This happens because cocaine acts as a super potent vasoconstrictor. It basically squeezes the arteries tight, drastically reducing blood flow. This extreme narrowing can literally starve the brain of oxygen, leading to ischemia and devastating strokes. And we see this even in young, otherwise healthy individuals. That brings us to part 4, amphetamines and MDMA. Now, what's really interesting here is how other synthetic stimulants alter this core mechanism. There is a stark contrast between these two drugs. So we know cocaine locks the doors, preventing the bouncers from clearing the room, right? But methamphetamine, it's much more aggressive. Methamphetamine has a structure so similar to these transporters that it actually reverses their normal function. Instead of just blocking the doors, it actively forces the neurotransmitters out of their storage vesicles and just dumps them directly into the synapse. it essentially kicks the doors open from the inside, forcing a massive, completely unnatural release of chemicals. This is exactly why meth is far more potent, leads to way higher concentrations of synaptic dopamine, and crucially, causes longer, significantly more neurotoxic damage to the nerve terminals themselves. Then you have MDMA, commonly known as ecstasy or Molly, which tweaks this mechanism yet again. While it still triggers the release of dopamine and norepinephrine, MDMA heavily targets the serotonin system. It binds to serotonin transporters, flooding the brain with this specific neurotransmitter. Now, this flood is what creates those subjective, really powerful feelings of emotional warmth, empathy, and time distortion. However, this comes with severe physical risks. The sources note that moderate to high doses can actually cause the loss of serotonin-containing nerve endings. We're talking about potentially permanent damage here. Plus, MDMA disrupts the body's ability to regulate its own temperature, carrying a profound risk of fatal hyperthermia, which can quickly lead to rapid liver, kidney, or heart failure. All right, part 5, hallucinogens. So let's shift gears entirely. We are moving away from stimulants that redline the system and into hallucinogens that fundamentally distort the brain's perception of reality. Unlike stimulants, hallucinogens like LSD and dissociative drugs like PCP profoundly disrupt our sensory processing pathways. They specifically interfere with the neurotransmitters serotonin and glutamate. This disruption alters how the brain perceives time, motion, color, and even your own concept of self. While they might not constantly redline the heart like cocaine does, they can trigger profound, terrifying panic, paranoia, and completely unpredictable behavior. Dissociatives like PCP can also cause a really dangerous disconnection from the physical body. This can lead to hazardous actions alongside dangerous physiological shifts like heart rate abnormalities and respiratory depression. And finally, part 6, ER management. So when a patient actually arrives in the emergency room with their cardiovascular and neurological systems in absolute overdrive from these substances, what do doctors do? Well, the triage protocol is systematic and fast. First, doctors secure the ABCs: airway, breathing, and circulation. Standard stuff. If the patient is experiencing severe agitation or seizures, they administer benzodiazepines, like diazepam, to calm that dangerously overactive nervous system down. If the patient is overheating, they have to rapidly cool the body to under 39 degrees Celsius, that's 102 degrees Fahrenheit, within 30 minutes. Otherwise, they risk organ failure. But here is a absolutely fascinating, counterintuitive medical rule. Doctors must critically avoid non-selective beta blockers when treating stimulant-induced chest pain. You might wonder, why? Well, because beta blockers calm the heart, but they leave the alpha adrenergic receptors completely unopposed. So if you block the beta receptors, the alpha receptors are free to squeeze the coronary arteries even tighter. That worsens the vasoconstriction and could potentially cause a massive heart attack right there in the ER. Wild, right? So we've seen how these substances totally hijack our biology, from locking those microscopic transporter doors to tearing macroscopic arteries. Now, in the ER, medical teams can treat the acute physical symptoms. They can cool the body, they can calm the seizures, and they can support the heart. But I really want to leave you with this provocative thought. Since these drugs so profoundly and effectively corrupt the brain's fundamental reward and learning circuitry, how can future medicine ever design therapies to actually reverse that underlying molecular damage? While researchers are out there investigating neurotransmitter-based strategies and even stuff like drug vaccines, the ultimate cure for the neurochemical adaptations of addiction remains one of modern medicine's greatest, most urgent puzzles. Thank you so much for joining me on this explainer. Keep questioning, keep learning, and I'll catch you next time.